So Tara, I was really surprised to learn that there are some different types of headaches that can benefit from physical therapy. And frankly, I was excited to learn that. What are some different types of headaches that could really be remedied by physical therapy?
Well, there's a lot of different types of headaches in general, but more commonly we see headaches that are the tension headaches, where it's more the soft tissue muscle aspect of it is causing the patient problems. Cervicogenic headaches, which they can have that soft tissue and muscle part with it, but then they also have some instabilities or joints that aren't moving as well that are contributing to those headaches. Post-traumatic type headaches, where especially with a lot of athletes, or if they're really active, they can get them from post-concussion where they've hit their head, or even in things like a post-whiplash. Some of those residual symptoms can result in headaches as well.
So what are some triggers? I mean, obviously there would be those post-whiplash, but is that the type of thing where you can go throughout your day and be fine, and then all of a sudden it comes on you, or is it where you notice right away after that sort of traumatic injury?
Sometimes it can be right away. You know, when it's more acute, a lot of times those patients have a lot more of the muscle tightness and stiffness. That's the more common thing that they'll come in saying. But then you'll also notice things that, you know, as the day goes along, as they get more fatigued and tired, they'll get some of the symptoms. They've noticed, like, I've been sitting at the computer longer, so posture also can play a part into that as well. But you know, other things like they're just day-to-day activities of how hydrated are they, you know, and as things progress and go along, sometimes we find that those other factors of just day-to-day things can contribute to those headaches as well. So we discuss those with the patient and kind of try to help see where those factors may also play into it.
Now, I know that I, for example, am not an athlete, have not had any sort of injury, but I do suffer from quite a few headaches. If I wanted to come into Indiana Physical Therapy, it's not as easy as just coming into your doors. Unfortunately, here in Indiana, I have to have a doctor's recommendation. How does that work? Tell our viewers.
Basically, it just means that you need to be in contact with your physician and make sure that they're aware of, you know, those symptoms as well. And a lot of times it's just a matter of going in and seeing them and interacting and communicating with them as well, getting basically a physician order a referral, and then once you obtain that piece of paper that says that you need to come in for physical therapy, you can contact one of our offices. All 10 of our locations actually do the headache therapy, so to the convenience of the patient, there's throughout Fort Wayne and kind of even in the region for them to be able to conveniently get in. And then once they contact the office, the front desk can get them scheduled and get them set up. And in a lot of instances, we can get them in within 24 hours and sometimes the same day, you know, especially if somebody's really having problems, or if they're calling and saying, hey, my doc said I need to get in, you know, as soon as possible. We try to accommodate the location at best, and then also the convenience to the patient.
And for someone who is experiencing headaches, or for someone who maybe is just having questions about whether or not this therapy may help them, what can they expect when they come in for that initial consultation, or once they have had that consultation, what can they expect as part of their therapy for their headaches?
Well, most of the time when they come in, you know, the first part of the session, that initial evaluation, is getting to know the patient, getting to know what is going on, and getting more an accurate history of what their symptoms are, what those triggers are, kind of what types of things, you know, seems to cause those headaches as well. And then after that, more verbal kind of assessment, doing more of a physical assessment of seeing exactly what's going on with the neck, with the shoulders, what is going on with their posture. And then based off of those type of things, then we can kind of customize more of a home program and a plan of care that's basically going to be geared to that specific patient, and then doing a lot of education with the patient so they understand even what's going on and what that plan is, so that they have an idea as well.
Well, it's so exciting to know, like I mentioned, that this is an option. I think a lot of people overlook the fact that maybe right in their backyard, because literally IPT has several locations, 10 you mentioned?
Yes.
Right in their backyard, that there is this option for their potential relief. Headaches are something that so many people suffer from, so all it takes is going to your physician, saying this is something I'd like to look into. Your physician then refers you to IPT. You can come in and have it checked out. If you or someone you know is suffering from headaches, don't continue to suffer. Go to your physician, have them refer you to IPT, come in, see what they can do for you today. It's certainly worth it, and we will be right back on Insight.